Okay, hi. Welcome to the Lone Star Dowsers. This is November 2022. I can't believe this year has just flown by. And I'm Mary Lindsay Wilson, your program director. Happy to be here. And you are in for a treat tonight. We have Dr. Stuart Marmorstein, and he's amazing. He's going to teach us about his technique that he's developed called A.S.A.P., which stands for Assisted Self-Alignment Protocol. But just to give you a little bit of background, he has been practicing muscle testing, which, as you know, is a form of dowsing, as a chiropractic student since 1976. And he's used it in his therapeutic detective work throughout his career as a holistic doctor of chiropractic in Houston and in New York. Applied kinesiology has helped him to combine scientific knowledge with intuition and continue to streamline ways to troubleshoot pain, health, and energy problems. And I'm excited. He's going to tell us all about A.S.A.P. And if you have questions, you can put them in the chat. And we're going to get to, I'm going to attempt to be able to be zoomed so you can actually see him doing this process. So without further ado, welcome, Dr. Marmorstein. Or do we call you Dr. Stu? What do you prefer?
Stuart's fine for tonight.
Okay.
And some of my patients call me Dr. Stuart. I'm Stuart. I'm not big on formality, and excited to be able to share this with you. So back in early May, I was traveling and crossed the Atlantic Ocean, had a 6-hour layover, and then went to my next location where I was hoping to get a little bit of rest. And while I was getting ready to go to sleep in Lisbon, Portugal, I got the inner message, don't go to sleep just yet. You're going to be getting a big download of information. So I prepared to take dictation, and it took about an hour and a half or so to write down the beginnings of what became A.S.A.P. over the last few months. And it's changing and developing and evolving every day. And it's an extension of some research work that I've been doing for a while, but goes a bit beyond. One of the things about A.S.A.P. is it's totally non-forceful. I just got an email today from one of the chiropractors who took a class with me in A.S.A.P. a few weeks ago, and she was saying that she is doing almost no more osseous adjusting, and that she's been getting great results with the technique.
Okay, so for people who don't know what that means, so that means you're not going to jump on us or
Right.
rip our head, to crack us to get in alignment.
That's correct. Now, I'm not dissing traditional chiropractic or osteopathic or other methods of bringing about realignment. They can work. There also can be some problems that they can cause, or situations that can become complicated. Recently, I had to have a surgical procedure done, and prior to that, I knew that I was no longer a candidate for traditional chiropractic methods. I had to be under general anesthesia. The surgery took about 4 hours, and it was for an aneurysm that I had in my lower abdomen.
Wow, this is recently?
Around the aorta. It actually was just about 2 weeks ago.
Wow.
And
and here you are.
Here I am. So that was on a Wednesday. The following Monday, I was back in my office working.
Now, how does that happen? That's not very typical surgical recovery?
It was decently fast. I was happy with it.
Do you
And,
think your special technique, I guess did that on yourself, and
Yes.
that expedited your recovery?
Yes. Now, for those of you who don't know what an aneurysm is, it's an area in the circulatory system where arterial walls have gotten weak and have ballooned to a little bit larger size than would be ideal. And if you know that they're there and you take care of them before they rupture and cause you to bleed to death on your way to the hospital, not that bad.
Wow. So how would someone even find out if they had an aneurysm?
Mine showed up on a routine scan,
Wow.
so I was very fortunate.
Yes.
And but being out for 4 hours while people were working on me threw my lower back out of alignment, and that caused quite a bit of pain. Now, prior to that, I wouldn't have been a good candidate for somebody to push on my back or twist or use a lot of force on me, because that kind of force could hasten the process of getting in trouble. And I didn't. But while I was in the hospital, the team that was working on me had to be concerned with doing their job and doing it well, not with watching out for my lower back. And of course, I was totally limp, and some of my vertebrae in the lower back went out of alignment. And with this technique, I didn't need a table, I didn't need any instruments, didn't need an x-ray, and I was able to do some muscle testing and find out what needed to be done to get everything to go back in alignment. This method also uses a specialized form of cranial work. For many years, I have used and taught a number of forms of cranial work, and this method, A.S.A.P., has as a component of it movement of the 22 bones of the skull. In chiropractic college, students are taught to align the 24 vertebrae and the sacrum and the pelvis, and in some postgraduate classes, some things about extremities. And there are other methods that are part of this package that can turn muscles on that are weak. And I hope to demonstrate some of that tonight with the people who did show up live.
I think
Not
you'll
that
have
the
some
people-
volunteers.
Not that the people who are on Zoom are not live, but I can't reach you as easily from where I am.
Can your process be done long distance?
I haven't experimented with it that much yet.
That would be
long
really
distance.
interesting.
There are other things I can do long distance, but so far I've been working with, no, I have guided people who were long distance. I have some patients who are doctors who live at a distance, and I was able to guide them in realigning themselves, but I wouldn't really want to do that too much with lay people under normal circumstances.
Sure. Let's see. We have a chiropractor from Tempe, Arizona. That's
Wonderful.
online. Great. Dr.
Excellent.
Scott Miner. Yeah.
Welcome.
Yeah. Welcome. Got a great crew. So, okay. Wow. So you had this pretty incredible procedure done. It threw you out of alignment and caused a lot of pain. And here you are.
It took about 5 minutes to make all of that go away.
Wow. Okay, I can see everybody's hands raising here. Me. We're getting in line. Yeah.
So we'll do a little bit with everybody. Now, I also have for years been using kinesiology as a dowsing tool so that I could find out about things that trigger people to become weaker momentarily.
Okay, I'm gonna pause for 1 second and
Sure.
just say, so for people who might not know what kinesiology is, would you tell them?
Sure. Kinesiology is also known as muscle testing or muscle response testing. And it's a method where we can find out what the person's brain knows about what's going on in their own body. That way we don't have to do a lot of guessing. And let's see, it might be easiest to do a little demonstration of what a muscle test looks like.
Okay.
Would you be willing to
I
volunteer
would,
for a
of
second?
course I would. Do I
Okay.
need to stand up or is it okay to sit down?
You can sit down.
Okay.
But maybe if you can pivot a little toward me.
Okay.
All right. So if you hold your arm up like this,
Okay.
and I like to keep right angles there, and I push toward the floor and you just put the brakes on.
Okay.
Try not to let me push your arm down. And there are some rules to have better form, like not grabbing the wrist or going way too out on the hand and getting too much leverage, or having your elbow up higher, which I teach in courses I have taught them in courses for lay people prior to COVID, and I hope to be able to do that again. So I'll push down and you hold, okay?
Okay.
Now, without turning your head, can you turn only your eyes to the right?
Okay.
And now hold the arm again. And that would be an example
Yeah.
of
Okay.
muscle becoming weak in response to a stimulus, in this case, the turning of the eyes, which of course we have to do every day if we're going to do things like read and drive.
Exactly. Wow. Okay. Good demonstration.
Now, if you turn the eyes to the left, we'll see if it does it that way.
Okay.
And no, you're okay when you turn your eyes to the left, or if you look straight at me. But if you turn your eyes to the right, it makes some trouble. It's kind of amusing.
Yeah. So it probably tells a little bit more about what's happening on the right side.
It does tell a little bit more about that. So I don't think it's very nice to find something like that on somebody and not fix it. So I'll show you how we would do that non-forcefully. If that's okay with you.
Absolutely.
Okay, so we're not going to get into consent forms here and stuff like that, but we're all friends, okay? All right.
Yes.
So if I were doing more conventional chiropractic work for any of you out there who may not have had exposure to chiropractic adjusting, I would normally, if I were doing more conventional work, either take Mary's head and position my fingers in a way that would allow me to push it quickly to get the bone to move back where it belongs. Now, we haven't talked about why alignment is important yet, and we will get there, but we were just trying to show what a muscle test is like first. And if it's easier to see, let's use your left arm.
Okay.
We're really testing the brain here, not checking to see is the arm okay. We need to know that the arm is okay before the test is valid. So if I push here, then nothing is blocking your view. And again, if you turn your eyes to the right, we get this.
Wow.
Okay. So
It has nothing to do with the arms. It's what's
we're-
happening with my eyes. Yeah, it goes weak
Right.
each time.
The eye lateralization or turning is a stimulus that shouldn't create a problem, but in your case, momentarily it does. So we'll correct that. Now, I can tell you from my experience that the third cervical vertebra is out of alignment in your case. There are lots of ways to correct the problem. This one's a little more long-term. So if it's okay, let me just check a spot on the side of your neck. This is 1, 2, 3. And if you hold the arm again, the arm goes down.
Yeah.
Okay. So if we didn't want to use force and we didn't want to use an instrument that's spring-loaded to click it back in place, I could just go under the cheekbone here along the corner of the eye. Then the bone would put itself back in place, hence self-alignment. 1, 2, 3. It's back in alignment. And if you turn your eyes to the right side again, you don't get weak anymore.
Wow. Wow.
So
Yeah.
simple example.
Very simple. So you're
Okay.
kind of like a body wizard.
Do the best I can. That's what I have. So let's see. Let's talk about alignment for just a minute before we go into doing more of it. One could legitimately say, well, why bother with alignment? You know, most people are walking around and they're not aligned all that well, and they get by somehow, or they take medication for the pain that being out of alignment causes. But there's a couple things that health and dowsing have in common. We're concerned with flow, which under most circumstances and in most contexts is a good thing. And we're also concerned with control. If the body is under the control of the central nervous system and the brain, it's going to work better. If the brain somehow can't get the message through to the body, then the body may struggle, both in terms of muscles and joints and in terms of internal organs.
You know, that's a great point. Raymond Grace, famous dowser,
Yes.
he does things all the time. And something that he's found a lot is that the brain is not in alignment. It's kind of, his words are like it spins, like did the counterclockwise, like opposite from however is. So here's another dowser, I guess, finding a similar issue, but
Yeah,
under a different thing.
Well, our sensitivity is a double-edged sword. It fixes it to where we can have a very rich, full life on the one hand, but it also means we can get in trouble more easily because we are affected by many things that happen to us and inside of us. Let's see. Catherine, would you volunteer for one quick thing for me? And let's see.
You want her to sit here, or do you want her to sit in that chair?
What's easiest?
I can.
If I don't use that table tonight, I mean, if people wanted to see leg length changes or things like that, we can use the table, but otherwise.
All right, then, yeah, I'll have her sit here, and then we'll have a place for question and answers later, and I'll pop back. How about that?
Sure.
Okay. Next. No, you don't need to. It's no one needs them. It's just if someone asks a question, then.
Okay. Hello, Catherine. We're old friends.
Yes, we are.
And one of the things I wanted to check is whether or not you have a particular kind of a destabilizing factor. Now, things that happen to us. Yes.
Okay, perfect.
If you want to move a little closer, you can, but you're on. We can all see you and you can see us. Okay. All right, so let me borrow an arm, whichever one you choose. Let's use this one.
Yeah.
This is good. So we keep a straight elbow. I'll push down. Again, you just stop me from pushing your arm down. It's a good arm. Okay. Now, can you push your right toes into the carpet? And now hold the arm. And we get that. Let's try the left toes. Oops, what is that? Okay. Same thing. All right, so what that means is that anytime Catherine would put weight on the front part of her foot, as in walking or going up and down stairs or putting her foot on the gas pedal or the brake pedal of her car, muscles are turning off all over the body.
Wow.
So if that happens, then that would mean that in order to stay in alignment, she'd need to have very frequent visits. Okay. And there are certain complicating consequences that happen when somebody needs to constantly be tweaked, if you will. So we can use acupuncture points without any needles, just pressure, to permanently get that problem to go away and not come back. I guess that's redundant. Permanently go away and not come back. Okay, we'll call it emphasis. Okay, but if putting pressure on the foot makes trouble, then person would be reasonable in saying, well, whatever you did last time felt good, but it didn't last, and I'm not going to just do this on a frequent basis for the rest of my life. So if we can get rid of things like that, it's good. There are a couple of points on the thighs I can stimulate, or if Catherine would rather do it herself, I can show her where they are and she could do it. And then that problem will go away. But did you tell them what you noticed when you put the weight on your front of your foot and I tested your arm?
Well, when I did it with the right foot, it was very weak. The
Yes.
left foot wasn't as weak.
Wasn't as weak. Okay. So if we do try pointing your toes out and hold. Doesn't do it. And if you tilt your foot that way, doesn't do it. But if you put pressure on there. Okay. So if you're
Wow.
trying to drive to an appointment somewhere, even if you had just gone somewhere and had an adjustment or a massage or some other form of treatment, you get in trouble. So if you wanted to rub here and here with your hands, do that a second. That's it. You did it. And now push your foot into the carpet again.
Oh, wow.
A little different.
Yeah, I feel like Man of Steel.
Okay. So thank you very
You're
much
welcome.
for
Thank
helping
you.
with that. So
Okay, so I'm
Mary's
gonna
back
ask you
for-
how do you know that for me that it was right here and for Catherine on her thighs?
Well, I have over the years kept very careful records in my office. And when I asked for the points that would solve different problems, which I basically do every day in my normal practice, everything goes into my computer. So, and I have a good memory. So I remember a lot of this stuff, not all of it. And if I need to look something up, I'll look it up. But these are very common things, so I see them all the time. I don't know if that answered your question.
So
But-
years of practice and
Yeah,
knowing and keeping records.
yeah, so go ahead, Catherine.
How long does the good effect last?
I would expect that to be permanent.
Okay, so people were asking where did you tap on the thigh? So I'm trying to think, can I show the?
Sure.
Um,
Yeah, it's right
like,
here.
so my knee is kind of like, I don't know,
Yeah.
right down here. So like kind of from the inseam of your pants over 3-ish inches, kind of.
Mhm.
Yeah, so I think does that answer your,
It's a little
yeah,
closer.
kind
It's
of
closer to the knee than it is to the
groin,
groin.
yeah.
Maybe a third of the way up. But I don't know if it would work if somebody didn't do the test beforehand to show the brain that that's what we're working on. So if you just were to rub the entire surface of the body, that's where you're going to find all of the points. And it doesn't mean that if you were to do a full body massage where you covered every possible square centimeter of the surface, that it's going to solve all of your problems. That would be nice, but I haven't found it to work that way in real life.
So you find out what's weak and then you're telling the brain what to do.
Right, we're having a conversation and then your brain takes the impulse and makes a change.
Because our bodies are self-healing,
Right.
self-correcting, but they
Right.
need the
Um,
information, really.
Yes, and taking it one step further, they can be self-realigning without having to do cracking, popping, twisting, jerking, or heavy pressure. It
Yes,
does-
please.
It doesn't mean that you can't get vertebrae, pelvises, and so forth to go back in place with force. And of course, during most of my career, that's exactly what I did. And there are still a few people that I see who prefer that kind of an approach, but there are many who either can't or shouldn't have that kind of treatment. For instance, if somebody else had an aneurysm, it would be a bad idea. If somebody said, I have really bad low back pain, and I'd really like for you to make it go away, but I'm 8 3/4 months pregnant, I don't think I can lie down on your table. I could work with them sitting just as well and get that low back to get realigned and pain would go away.
So, one of my brothers was visiting this last week and he has, I guess, like a disintegrated disc in his neck,
Yes.
horribly painful. Probably traditional chiropractic would not be his friend.
Well, it's going to depend on the skill set of whoever's working with him.
Right, but something
And-
like this.
And
that
there are
doesn't-
other ways it might work, but with this, there really wouldn't be any risk. So, throughout the healing arts, there is something that we call do no harm. It has its origins in antiquity, and I think it's a good guideline. So if at least you can manage to not make things worse, if you don't help somebody otherwise, that's a good starting point. But if you cannot make somebody worse and help them to recover, that would be preferable.
So do you think this, or I'll just say, in your experience, have you found your process to be helpful to people that have degenerative disc or people that don't have, maybe are missing disc even?
Sure, it works very nicely for those issues in my experience.
And relieves pain?
Yes, now it doesn't mean that somebody might not need some sort of an orthopedic or neurological surgery
Mhm.
if they have gone too far. But most of the time, this is all the people I see need.
I love it. It kind of makes me think like tuning forks, that the body knows how to, that there's someone I follow that does biofield tuning. And if you just remind the body of the proper alignment, it will align.
Yeah, I think
Energetically,
we're
certainly.
getting rid of an energetic imbalance, and then the body can express itself through a better alignment. And I believe it probably does work through frequency, and it doesn't take a strong stimulation. So you don't need to use electricity or needles or moxa in order to get these effects. Again, this is not a traditional Chinese medicine or TCM approach. And I think that people who do use those approaches have a lot to offer, and this is just a different thing. So I am using the points in the map, but I'm using them in a different way. That makes sense.
Do you have any questions in there? Let's
Just a
see.
couple of-
Holly says, I went to see this man and he really does help a whole lot of different things.
Thank
So,
you.
yes, I think you've got some fans in the crowd. Susie says, can you explain about the body energetic?
Well, I think that the body is made of energy, and energy and matter have been shown to be different forms of the same stuff. So, and I think that one other piece to this is that when energy is flowing, it's intelligent and it can do things that are seemingly miraculous. In terms of explaining it, easier said than done. But I think what we're looking for is finding our way through a challenging life where we have lots of things coming to us, at us, and in us, including our memories. I had somebody who was in today who had problems with adapting to jalapenos, tomatoes, and corn. And they were causing some gut problems, and we were able to use methods like this to change them. Now, other people don't have problems with those foods, but somehow he came in with or developed a sensitivity to them. We were able to take that away. We can also take away sensitivities to words
Yeah.
and phrases, and lots of other
Animal.
stimuli.
Yeah, all that kind of stuff.
Yes.
So what about, I know that when we experience trauma of some sort, it's usually held in the body, right?
Physical trauma you're talking about?
Yeah, it could
Yes,
be
sure.
emotional or physical.
Yes.
And
I
that could
believe
cause a misalignment, right?
It can cause recurrent misalignments, and there's a method that I learned earlier on called injury recall technique, and I've taught it in some of my classes for lay people. I have a much more streamlined version now, and if anybody'd like to see that, I could show you how that works, and that might be a good place to use our table. But I would have to do it with somebody who's not wearing a dress, because if I were going to have somebody lying on their back on the table. Okay, did I see a hand for a volunteer? Okay. All right.
Got a few.
All right, well, let's do one injury. I know this is supposed to mainly be about the self-alignment. I think we have time there. If you're keeping time,
Yeah,
Mary, then
I will keep in time.
don't let me go too far into the weeds, and we'll so that we can show spinal and cranial alignment. But let's do something with a physical trauma. Now, physical trauma could be, so that if this eliminates anybody, it could be a break, a sprain, a surgical scar. So while I was in the hospital, I also worked on my surgical scars. A
So
burn.
You're looking for someone that has that.
Somebody that has that. Okay. What is your
Okay.
name?
Eloise.
Eloise.
Okay,
I think
Eloise.
we've met before, right?
I don't think so.
Maybe not. Okay.
Do you want Eloise on the table?
Yeah, let's go to the table. now.
Okay, so I'm gonna turn our, yeah, I'm gonna have you go that way, and I'll turn our
Okay.
camera so we can see the table. So you guys can see what he's gonna be doing. You can see
Okay, so
Mindy's beautiful
Eloise,
house.
We're getting the camera set up.
What do we need the
All
camera?
right, so you're okay with being filmed, because the internet has a very long lifespan, from what we can tell. And if it gets onto YouTube, then you'll see it. That's another good reason for people wearing pants on.
I wanna see your head, but do you have enough of Eloise in the camera to,
Well, we'll probably change. I want to show a good before and after.
okay,
The reason I like good before and after as part of the demonstration is the more believable.
right,
Okay, so if we haven't mentioned it before, total strangers before today, then yeah, that's a good thing. So you have nothing to gain by having your body behave in a way that you might not expect, right? Okay, so where did you have your injury?
Numerous. abdominal operations.
Okay, well, let's do something
Okay,
like
so if
that.
you guys didn't hear that, Eloise has had numerous abdominal operations.
Okay, all right. So can you put your hand over the site where they did one of those? Doesn't matter if it's laparoscopically done or if it's done through a catheter, as was the case with me, or if it's the old-fashioned long scar on the surface. Okay, so if you hold this arm, it looks good, right? The arm does not go down. Now, one way of doing this test is if you tilt your head backward and hold the arm doesn't stay up. Did it feel like I was overpowering you, or did it feel like it felt like it just got weak, right? Now, I used to do it this way with tilting the head backward, but because a lot of people have neck problems, there's a nice other way to do it, which is I could just touch this acupuncture point on the wrist. And if I'm doing that while you're touching the surgical site, the arm also goes down. Okay? Now, there's another interesting thing that happens when you fix one of these, which is typically a person's hip range of motion out to the side. That's called abduction, ABDUCTION, will get bigger. And there's plenty of stuff on YouTube already showing that with other ways of doing injury recall technique. Why don't we see if that would happen to you, okay? But the main thing we want to do is, besides demonstrate something, is get it to where this old trauma that happened, I don't know how many years ago, is no longer creating an energy flow problem in your body, and it's not going to cause recurrent structural problems, for instance. So if you lie on the back a minute, you're going to see, would it be easier if we had the legs at this end, you think?
You want to watch the legs?
I think that would be interesting.
Okay, hang on, guys.
Okay. Doesn't matter. Whatever. Okay.
I can't see
All right.
it. Here's
All right.
the,
So
see.
if I were to take this, if you were more like above, you'll get a better view. So is it okay, Eloise, if I take your leg out to the side?
I cannot see what.
Oh,
Looks like
true.
it's right.
All right, so other people, can you see the camera?
Is it showing,
Because I'm gonna be busy again.
okay. so I'm
Okay,
just gonna
let's go on the legs. So I'm gonna take the leg out to the side and we'll see how far it goes comfortably, but we'll stop. That looks like that's about it, right? That's about a 45-degree angle. Can that show on the film? That's
Yes.
good.
Yeah.
Okay, so now if you put the hand back on the scar, and I just rub the area right there, that's pretty easy, right?
So it's just beyond the wrist.
And now let's see how far the leg goes. Maybe it won't make any difference at all. Let me go out here.
Wow.
That's a big difference.
Wow.
Probably just imagine.
Wow.
That's about 10 years of yoga.
Okay, you did a great camera job there.
Hey.
Did we catch that okay?
This one side is all it needs.
Oh, well, I thought it'd be easier on just to show it on the one side, but it should be as about as good on the other side, I would guess. Oh, in all fairness, we didn't do a before test on this side.
Wow. Sorry, no, not doing a good job with the camera.
Oh,
But
yeah,
yeah, so you guys see her leg is, I mean, she's almost doing a split. Very impressive. Do you still need the camera here?
no,
Okay.
now we're good. Well, we
Okay.
might do something else here while we're here.
Okay, I'm gonna check and see if we have any,
I thought I might, since you've seen that, maybe we'll just show what can happen with cranial work. Okay. All right, so
Do we,
this
do
is
we
not
need a new
course on
volunteer
how
or
to
same
do
person?
this, but this is just to show you that things can change without having to do any rough stuff. Okay. It doesn't mean you can't do it more forcefully, but that's up to you what you choose, right?
So now that should last. It's not like she's gonna need another adjustment.
That was not an adjustment. That was not a realignment. I didn't test any vertebrae before and after, but what we got rid of was the energy blockage from the old trauma. So that's called injury recall technique.
Injury recall, okay.
So far, the only thing that you could interpret as an adjustment was when we moved your C3 vertebra at the beginning, so that when you turned your eyes to the right, it wouldn't make you go weak. Okay.
Will
Okay.
that help when somebody had their back fused?
Sure, yeah.
Have you had your back fused?
So it's interesting. Well, thank you, Eloise, for
Thanks.
Thank
uh,
you.
Good job.
volunteering.
Go to yoga now.
It'll be more fun. Okay,
More flexibility. Wow.
okay. Has anybody had let's say a concussion? Anybody here has had a concussion? Bad whiplash? A bad whiplash? Anybody ever had an airbag hit them in the chest? No? You did it. Okay. Well, let's just do one thing with you on the airbag thing. And then we'll do a little work with you on the head. Okay.
Okay, so if you are online, I just want you to give me a thumbs up that or put in the chat, you can hear Stuart from where we are. I just want to make sure you're getting that, because he asked about someone being hit with an airbag and someone else who had whiplash. So that's what we're working on now. So you
Okay.
want Connie to come and
Sure, come on up, Connie. Welcome. Hello. Yes. Oh, okay. Okay. Well, this is gonna,
so she said she just was in an accident.
October
in-
last year.
Yeah, and about a year ago, and the airbag went off and the seatbelt.
They said seatbelt went all this, so I had to bruise all of this.
okay. Well, that does not sound like much fun.
Going back and forth, my whole
Oh,
spine felt.
goodness.
Okay, you
Okay,
want me to get a little bit closer?
Yeah.
So,
all right, so when something like that happens to a person, a lot of times the sternum will get pushed backward toward the spine, which is not where it belongs. Everybody agree that that's not where the breastbone or sternum belongs?
yes,
It's supposed to be in front, but if it gets pushed backward by force, physical, mechanical force, that could be a problem. And it could affect the shoulders, it could affect breathing,
eating,
it
yeah.
could affect upper back and digestion, which wouldn't be good.
That's fun.
Now, supposing you wanted to find out, did that happen to you? Because so far, it's a big assumption that that happened. I don't think it's unreasonable, but we haven't proven that it's happened. So I found that there are places on the head mostly that you can use to find out if something happened on the body, and that there's a corresponding place that we can touch to find out if the sternum did go backward. Okay? May I borrow an arm? I'll push toward the floor and keep the elbow straight and try not to let me push your arm in, okay? And you're good. Now, the place I found for the bottom of the sternum would be right here. And if you hold the arm again, it goes down. Right?
He's just pushing in the middle of her
No.
nose.
Now, of course, I'm not even pushing, I'm just touching.
Just touching, wow.
Let's see what happens if I use my pinky and I go a little further up the forearm so I have less leverage. Okay.
Arm
So,
went down.
so that tells me that the sternum did go too far back. So that's going to change the angle of the sternum up here where the collarbones are. It may change the upper back and could interfere with breathing because the rib cage is going to be pulled backward by the sternum. So supposing we didn't like that, and we wanted to change it. If I use these points right here,
You guys see that?
with a little fast. Okay, so we got it.
All right.
We just went over the thumbs. And then we go back to here. And even if I push really hard, the arm stays up.
It did.
It did.
Wow.
This one hurt, this one did not.
That one hurt and that one didn't. That's not uncommon. Sometimes they both hurt, sometimes neither. But it worked.
So that would send the signal to her brain for the
Yes.
sternum to kind of what, release? or-
Yes. Release and reposition itself.
Mhm.
And there's lots of times when something gets pushed to bad place. I'm sorry, I interrupted you.
No, did that happen when you did the nose and the?
When I touched here, it just showed me that the problem is there. I
Oh.
should have actually touched the sternum afterwards to show that the two are connected. Let's see. I think you have a problem too. Even if that didn't happen to you. Oh, whiplash. Okay. All right, well, there's other ways that the sternum can get pushed backward. It's not uncommon. Sometimes it even happens if somebody pushes really hard on the back while somebody's face down. I don't know if that's ever happened to anybody in the room. So if anybody else thinks that it's there and you want to see if there's a connection between that point on the nose and the sternum, I could show you that. Come on up a second. Do you mind letting Francisca have the table for just a moment? You doing okay on that?
Yeah, we're doing good.
Okay, all right.
Not a problem. So you keep telling me what you wanted.
Okay, well, let me borrow an arm again. You see, okay, we're good. All right, now, is it okay if I touch you right there?
Mhm.
Okay, so if I touch right here, I'm actually touching the sternum. And it doesn't really take a whole lot, does
Wow.
it? Okay.
I'm trying.
I know, that's what's so sad. Okay, so then we could go up here to this part of the nose. You get that.
Mhm.
So you could think of this as the voodoo doll's sternum. Okay, so if we wanted to change that, then we could go to the same 2 points. Get them right there. And then we
So
go,
you're going just inside the wrist?
no, in between the
Oh,
thumb and
okay,
first finger.
okay.
Okay, so afterwards, you know, if I'm showing certain other kinds of things, I don't want people trying to realign their own spines at home. Go here, now you're strong. And go here. Same thing.
Wow.
So everything in the body, every vertebra can be, it's mapped out, and you can find out which direction it's going and and there are points that will help everything find its way back home. That'd be a nice way to put it.
So that's your magic techniques, huh? Your A.S.A.P.
Yeah.
Okay.
All right, and you can also turn muscle. Let's see if we can turn muscle on. We'll turn on a couple muscles for you that'll help your posture, and then we're going to do a little cranial work. Okay, do you mind standing a minute? So one of the things that makes vertebrae susceptible to going in place, besides the things we've already talked about, is weak muscles. Sometimes if somebody has an injury, their muscles will turn off. So when I say weak muscles, I don't mean in comparison to somebody else's who's going to the gym and working out constantly. It just means something happened and they don't do what they should do because there's something interfering with the signal. Let's do a test of the lat. Mary, would you mind standing in front so you can see a little bit lower? So that's perfect. Thank you. So if I try to pull your arm toward me and you try to pull your arm toward you, keeping your elbow straight, I'd like to see what happens. Under normal circumstances, you should be able to stop. Okay? Ready? And it doesn't look like you can stop that well at the moment. So that's the latissimus dorsi muscle, the thoracic division. If we want to go lower in the muscle, it's a shoulder muscle that goes all the way down to the hips. If you turn all the way in, we're getting the lower part of the muscle. So if you pull here and I pull out, you get that. I wonder if the other side's any better.
Look on your faces. That's a good.
And pull toward you, I'll pull toward me. Ready? Okay.
We have no resistance.
I know. So even smiling doesn't make it stronger. And pull in and I pull out. So supposing we wanted to get those muscles back so they'd support the vertebrae staying in alignment, I could go to this spot right here, and this spot right there, and then we can try them again. Ready? Pull toward you. Oh, that looks good.
Wow.
So you can do that for those spots. Won't fix any muscle in the body, they will fix those specific muscles. But I have spots for every muscle in the body. You go in, I go out. That's nice.
Wow. Wow.
And then pull again. Quite good.
Yeah, so you do one, it works for both.
No, I did 2 points.
Oh,
I did
okay.
one for the left and one for the right.
Okay.
So, it could be that if I did 1 point, it would help both. But I figured why take a chance? I'm not going to overwork myself rubbing 2 points.
Yeah.
Okay.
Okay, A.S.A.P.
Thanks,
Thank
Asal.
you.
Thank you. Thanks for being a good sport and coming up.
Yeah. See if we have, they wanted to know where you touched.
Oh, for that, just under the collarbones.
Oh, okay. All right, so now you're gonna do some cranial work with A.S.A.P.
Yes.
Who's had whiplash
Hi.
issues.
Whiplash.
Your head in there.
So
There we go.
one of the things that's very good about whiplash is that it means that the head did not fly off of the body. Okay. Okay.
That is a good thing.
It's a good thing. But because it didn't fly off of the body, it means that the muscles that attach to the head on one end and to the body on the other end are going to get pulled too hard, and they can pull the 22 bones of the head out of alignment. It's not the only way to get the head out of alignment. I've seen it happen from having something drop on top of somebody's head, or falling and hitting the head. Or sometimes it could happen from having a long intraoral procedure done. Or sometimes it could happen from fighting. Or sometimes it could happen from being born. So not trying to blame anybody, and I'm not saying people shouldn't be born, We shouldn't have the maneuver. But yeah, it's kind of a little late for that. But a lot of things can throw the head off. Or somebody trying to take a beer can and go.
Oh,
Okay, people who do that. It's not so. On the bottom of the head, mostly there are little holes, and that's where the cranial nerves come through from inside. They're basically extensions of the brain. One of the most famous ones is called the vagus nerve, which goes to all the organs in the body. So it's not a good thing if the vagus nerve is going through the hole and the head is not lining up right and the sides of the hole are pushing against the vagus nerve, that could wreck somebody's digestion or heart or
what, or keep their atlas from being in place?
it would definitely keep their atlas from being in place. So
I had 5 or 6 whiplashes in the span of 6 years, so.
okay. One would have been just plenty. Okay. All right. So you're an expert at having whiplash. Okay.
Actually, it stopped.
Now we
have a request for more atlas info, but we'll get to that.
okay. All right. So yeah, if the cranial bones, one of the cranial bones is called the occipital bone, and I actually did bring a couple of models with me. You can stay where you are. I'll just go over there and bring them over.
Oh, you want to bring it on? I have found when my atlas is out, the a little, okay, let's see. We have a little fake skull, and it got knocked over and the teeth fell out. And the tie was
All right, so this is a very special bone here. And you can see that it rests on top of the spine. Maybe I have to get a little closer. Okay, so this bone is called the occipital bone, and it's part of the skull. But
And is that what's also considered the atlas?
no,
Okay.
it sits on top of the atlas.
Ah,
So the atlas is the top vertebra in the neck. And you can see that it has,
so that's this.
right, so the little yellow
Okay.
things coming out the side represent nerves.
Okay.
The big yellow thing is called the spinal cord.
Okay.
And there's a place where the atlas has the occipital bone sitting on it. So the occipital bone is sort of like a hybrid. It's a cranial bone, but it's also in some ways like a vertebra.
I will tell you, when my atlas is out,
Yes,
I get extremely depressed. Like,
makes
like
sense.
clockwork.
Well,
Like,
well, it's going to affect the blood flow to the brain and the nerve supply to the brain. So that can change a person's mood and could also change hormone balance. So we don't want to have an atlas that's
no,
out
we
of
do
place.
not.
All right, so we'll take a look at that a little bit later. Okay, now I mentioned the vagus nerve. Oh, we have okay. So we have an expert
Oh.
dentist here, and he just put the teeth back in for me here. And
Do we have a name for this guy?
Open the suggestions right now. Okay, so we have a name, the skull. So
We can
this is
call it
the
Mike the skull.
okay. So Mike the skull. This is part of the occipital bone, and it comes around here. I guess it's not that easy to see on
There's
Zoom.
like little stitches.
Yeah, there's
Like, yeah.
little stitches are called sutures actually. And there are separations for the various plates of the skull. Thanks, Doc. And
Might have a little brain surgery.
have a little brain surgery. So this back bottom bone in the skull sits on top of the atlas. This is where my fingers are now. That's where the atlas
Oh.
sits underneath the skull. So when the skull is misaligned, or if the head is not sitting well on top of the neck, that can affect many things. The 11th cranial nerve comes through the same hole as the 9th and the 10th. The 10th is the vagus. The 11th is called spinal accessory. And spinal accessory nerve affects what are called the sternocleidomastoid muscles in the front and the upper trapezius muscles in the back, the neck and shoulder muscles both. So I would expect that if somebody had a whiplash, there's a good chance those muscles are what I would call turned off. Okay, if we test yours, A.S.A.P.ᵀ? Okay, let me move these guys out of the way a minute. Maybe Petey can chew on them. All right, so if we want to test this part of the upper trapezius muscle and isolate it, one way of doing that is I could pull the hand diagonally in front of you, like toward that stool, and you could push against it. So before we've just done the straight arm test where we're testing a group of muscles. Now we're testing just one muscle. So I'll push that way and you push away. And we get that. And if we test the other one, and I pull this way, we get that. Okay, it's pretty weak. And if we test this muscle, the trim the head 45 degrees and comes forward, I'll push back and you stop me if you can. Not just yet. Okay. So with this method, I've done many and taught many cranial methods over the years, but we're going to use a simple 3-part method to fix this now. Okay. On camera, live.
Magic happening now.
All right, so here's what we're going to do. First, I'm going to test something on your chin. If I turn your chin a little that way, oh, you don't have to turn your head. I just do that with your chin and hold the arm. Notice it doesn't quite work.
No.
That tells me that your temporal bones on the side of the head are rotated. Okay. So if I turn it that way, arm goes down. If I do it on this side, you'll be strong. But if I turn it the other way, weak. And your pelvis will do the same thing. So a lot of people who go around with uneven legs all the time, it's because their pelvis is off, secondary to the head being off, and the pelvis never gets better because the head doesn't get better. So if we wanted that to,
That would be why someone couldn't hold an adjustment.
that would be one reason why somebody couldn't hold an adjustment in their spine, is because their head is setting things up to where it's impossible. Okay. So if we wanted to fix that, let's see, well, should we use the vise or the hammer?
I'll just close my eyes.
Okay. Looks better. And the pelvis will also be corrected.
Wow.
Then the second part, I'll go here. If I pull a little bit up and forward, we're going to take care of the fact that the front part of your head is jammed back against the
And I
back part. of
feel
your head.
it.
Right, you did. Right here in your sacrum, that's too far backward. Let's see, I don't know if we can get that standing in it. If you don't mind, So this is, right here is called the sacrum, okay? If I push here. If I push here, the sacrum is out of alignment. So if you say, that's no good. We'll go to these points here. And I'm purposely not going to go into what these points are for just anybody out there to start trying to open a practice
Right.
based on what they've learned on YouTube. So the sacrum goes back. And that part's good. And we'll do the third part.
You know, that could probably, I would imagine, help people that have infertility.
To do that, because sacral nerves go to the reproductive system area.
Right.
So it could be an area to explore for people who have those issues. If I touch here, this arm goes down. Touch this one. Same thing. There's a couple points here we'll take care of. Going down your hands. And then that's good. And that's good. So you have a better head.
Thank you.
So if you sit again, let's just see if it did anything. All right. So if I push your arm toward here, remember this was weak before?
Wow.
Good. Excuse me. And here, that's good. Because now the opening for the 11th cranial nerve allows the brain to talk to those muscles. So now turn it this way and go forward. Or push backward and go toward movement. Not going anywhere.
Yeah, barely answered. Oh, sure.
So, it's good. It feel a little different?
Yes, life's brighter.
That's
Thank
good.
you.
Well, you're welcome.
So
Well, the
that's
optic
what you
nervous-
call a cranial adjustment.
That was a cranial adjustment. They can also do, I have some special effects points. So for instance, is it sore here? So we'll go to a special effect point here. That's like, okay. So anything that hurts from the head to the foot, we have spots to help them out. A little bit here. Just go in here. Okay. Okay. You're welcome.
Excellent.
Yeah, people are kind of like, wow. Do we have any questions online? Anybody? I think you're amazing.
Mary,
communication.
I would like to ask a question.
Okay.
Is it possible for us to keep our atlas in alignment?
Okay, so the question is it possible for people to keep their atlas in alignment?
I think that it can stay for long periods of time. And based on your question and what I've seen happen with a lot of other people, it's easy for the atlas to go out of alignment if the conditions are set up to where the atlas has more forces pulling it out than keeping it in. So, for instance, if I wanted to test all of the muscles in somebody's neck, I would be testing 33 muscles on each side. So if somebody has large numbers of those that are off, or there's a big imbalance between right and left or front and back, it could be very challenging to keep the atlas in place. It's also the case that if something temporarily turns muscles off while somebody is, for instance, driving, as we showed before, by just putting the foot on the gas or the brake, So if somebody's trying to back out of their driveway and they don't know that they have a problem where they're putting pressure on their foot, turns things off, they'll get in trouble. I'll do one more quick demonstration. I don't know how much time we have left, but we're probably getting close.
We're good, we,
It's
have
only
like 20 minutes.
8:10.
It's only 8:10? Okay, well, I didn't know how long.
We're good.
We're good?
You're doing great.
All right,
This is pretty fascinating.
all right, so the whole area of what you're basically bringing up is the whole point of stability. So atlas isn't anything in the body can be unstable if these destabilizing factors are not addressed. Probably a lot of people in this room would have a problem just standing on a hard surface. Okay, you'd be one of them. You want to demonstrate this one, Mary?
Sure.
Okay. All right.
The-
So we have a new
I stand on it.
camera crew. So,
Okay,
so let's do an experiment. Okay, can you stand on the carpet a second?
okay.
Okay. So you're not pushing your foot into the floor, which you would also have trouble with, but we'll get there. So if you hold the arm and I push down, the arm is strong. Okay. Now just a foot and a half to your right, there's a harder surface. It's not a carpet.
Yeah, the floors are stone. I'm standing on carpet right now.
Standing on carpet, you can see, I don't know if you can see, you might have to tilt it a little more. So that's carpet, right?
Yeah.
And the arm stays up. If you move over to here, and we test you. Doesn't go as well.
No, sir.
Okay, so if you spent your entire life standing on carpet, you would have a better chance at some sort of stability. But if you have a kitchen or a bathroom or a sidewalk or a gym or an elevator lobby where they didn't carpet it, or a ladies' room in an office building, you can get in trouble just standing. All right. Now that can be permanently fixed. Probably. I'm just going to go to this little place in fact. Right there. You're standing on the same stone, and your arm doesn't go. So yes, a person can become increasingly more stable if you get all of the things that are interfering with the stability out of the way. That could be anything from muscles that are weak long-term to muscles that are temporarily turning off in response to various stimuli. It could also be, you know, and I've seen anything could be stimulus. I'm sure there are people in this room who will go weak if the lights are off, or if they close their eyes, or if their skin gets wet. Lots of things like that can do it. I know how, and muscle testing, since this is a dowsing group, you could find some of these destabilizing factors with any dowsing method that you would use. Kinesiology is one way to find them, and I'm sure that there's more than one way to fix them, but I have found something that works consistently to do that. And if you take a methodical approach, you get to relative stability more quickly.
Okay, so, okay, I have.
Okay,
some other thoughts.
all right.
Let's see, well, this person says, are there any points, treatments, the correct eyes, cornea, cataracts? And I have that part too.
All right, so there are nerves, cranial and spinal, that can affect vision. In terms of specific pathological conditions of the body where there's an increased opacity of parts of the eye, that's not as easy to reverse. Maybe at a very early stage it could halt progression, But I don't see what I'm doing is, total means for eliminating the dental, medical.
But it could certainly.
But we can improve it, and I think we could do some prevention.
Okay.
But once it gets to a certain point, for instance, with my aneurysm that I had, I believe that the smart thing to do is to have the surgical procedure so that I can be around for a lot longer, and then I can do everything I can to take good care of myself. I don't know if that's a good answer. It's helpful to you.
Yeah, I think that kind of answers the question.
Okay. I'll got this question to you. You have another question? Want to sit here or?
Okay, we've got another question. I was gonna also ask you, I guess, after that, to explain kind of, what someone that would come to see you, kind of like your process, and then I know you do training for people too, so I want to talk about that before we close.
Okay, sure. Okay,
All right, you have a question?
all right. So you have your question.
Yes. Could what you were just explaining be a reason why my right side, when I fuse my back, it feels like it's shorter?
Yes.
Okay, so I don't know if you guys can hear that,
Okay.
but Mike had a spinal fusion, and he was saying that his one side
Right
feels
side.
shorter.
Okay, well, we can play with that a minute if you want. Sure. All right, so what I find is that there's two kinds of short leg for the uninitiated in this particular very specialized area. There's an anatomical short leg. So I have known people who have jumped out of airplanes and shattered their leg in many places. And when they put it back together, doing the best they could, the puzzle pieces didn't quite fit 100%. I've also, when I was in India for a couple of years, found that there were still some people around who were contracting polio, and anatomically the two legs are not the same length. But that's not the case with you. You acquired that after a fusion? Yes. Okay, so I find that most of the time when somebody's leg gets to where it looks shorter than the other, it's either coming from the pelvis or it's coming from the atlas, which has been mentioned numerous times tonight, the atlas being the top bone in the neck. We could see if we could make yours the same, and if tonight what we did was got them to be more even than they are now, then we would have to later on explore how do we keep it that way, assuming you like it better. But if so let's do a little experiment, okay? Do you mind being on camera for this? Okay, so in advance, I'm saying I don't know what will happen. The only thing I do know is we won't make anything worse and we won't hurt you in the process. Okay, so I have not taken any x-rays. I haven't taken a thorough history. I haven't done all of the things you're supposed to do. I'm not even wearing a mask. And let's just see if we can do something. Okay, so let's find back if the head here and the feet here.
I'm gonna
We could get a paper
scoot
towel
this around.
maybe.
see if
And
we
we'll
can.
we'll see if the legs look even or uneven. Okay. So the feet are down here.
I need to show the feet.
That would be helpful, but it may
Okay,
not
let
be.
me,
Kind of from above is the best.
just can't
okay.
see when it's from above.
Okay, all right, well, let me
See,
get,
can you
if
see?
if I put my fingers on the ankle bones. can you
I'm
see?
sorry, y'all. I'm gonna have to come on this
Okay,
side.
you might have to come to this side.
Okay. The,
All right, so if
Okay,
I
can we
go
see?
like this,
All right, here we go.
the right ankle bone here, well, you'd have to be, if you're above, that's the best. Just shining right down at that, but then you can't see the screen.
Well, I can see his feet in there. Is that
Okay.
what you want?
Well,
or-
if you see the heels, that's a better.
Oh, okay.
reference.
Okay, so let me see if I can
Okay,
see his, yeah, okay,
okay, so you can see that there's a difference, right?
yes,
Okay, and I would say that's about 3/4 of an inch difference, okay?
okay.
All right, and if you let the legs relax and I turn the feet in, they turn about the same. Okay. So we'll see if we go to the pelvis, if I put my fingers on the edge of the pelvis, definitely higher on the right, which is the leg that looks shorter at the feet.
Mm-hmm.
I don't know if you can see that from where you're sitting or not, but if you want to see it and you can't see it, I don't see any reason why getting up and walking over here would be disadvantageous.
Super subtle, but yes.
Okay. Okay. So there's a difference. All right. Can anybody else take a look here and from the top down is best and see that the heels are not matching?
Yeah.
Okay. All right. So let's just do a little cranial work first.
I'm just
okay?
apologizing to everyone who's watching this because I'm sure you're dizzy by now. But then you need to have an adjustment to.
It's hard. You would have to be hanging
know.
from a scaffold above and holding.
I've got my laptop and I'm doing the best that I can here.
Okay.
Okay. We gotta,
You got them. Okay.
okay, let's see.
All right. So,
We can kind of see Mike's head.
all right. So I see a low eye on the left, a low eyebrow on the left. So if I were going to make a guess, let's say if we took the arm and I pushed, we're good. If I turn the head this way, you feel the difference? See, if I don't do that, you've got a wonderful, muscular, strong arm. If I just do a little rotation here and your temporal bone goes down,
Whoa.
okay? And if I go to the other side, it doesn't matter which arm. I go like that, we get the same kind of a thing, okay? So what I have found is that the two sides of the pelvis are going to do what the temporal bones are going to do, okay? And let's find out if that's true. So if that were the case, that I needed to go that way, then if I got under the ischium on this side and I lift it, then your arm would go down. Whereas if I went to the ilium, the top of the pelvis, you'd be strong. And I'd expect to find the opposite on the other side. So if I go under here to the ilium on the right, it goes right down. Whereas if I go to the sit bone or ischium on the right, it doesn't. Okay, so then we'd want to see if we could make the head better.
Sounds like
So-
a good plan.
All right. I'm intentionally not discussing where I'm working on that. But we go back to the head. And we go-
Wow.
And we go back to the sit bone on this side and push from it. Not getting it. Okay, try again. Push. And if I lift here, still a little bit off, so I'm going to go to a different set of points that I know that are good for that. It might not be that the pelvis will stabilize until we get the rest of the head, but there are some points back here that before I knew about the head, would take care of that. Now, if we go under here and push again, now we've got a good pelvis. So let's finish up the job with the head. Pretty obviously not good. So go here, get that point. Now that looks good. We'll go here. There we go. So now we have to fix that. And there's a spot here I want to get. There's a spot here I want to get. And then that's good. And that's good. We'll go down to the legs, and they are completely even.
Wow. Yeah, I see the tennis shoes. I don't know if that translates here, but
Okay,
yeah.
so we'll see if that feels a little different.
You can put your arm down.
You're also, yeah, you can, actually, if you don't mind sitting a second, I
Here.
want to get it to where when you put pressure on your toes, if I tell you to walk around and screw everything up, that's not a good idea. Did I say that? Did I say that? Am I in trouble? So if you're just standing on the hard surface, you're okay. If you push your right toes into the floor, that isn't so good. And push the left toes into the floor. Okay, so we don't like that so much. You can sit for a second while we fix that, okay? Because I don't want you walking around and hurt yourself. So we'll go right where your hands were and get that. Now you can push the right toes into the floor and the left. It's good. So we haven't done a full alignment, and I still didn't adjust a vertebra on you directly. I know that certain ones will have moved as a result of the decompensation process. But walk around a minute and see if it feels any
I
different.
can feel different, yeah. I'm just standing up, I can feel different.
Wow. So do you find
Sure.
that after, he says
Good
it feels
job.
like he's level?
Self-alignment, self-alignment.
So now, do you find that that will hold?
It won't take too long to get it to where it could be
Mm-hmm.
his new normal.
That's great.
Doesn't mean that we've done everything we need to tonight, but we made a difference, and
Absolutely.
there would be muscular things that I would want to check and other alignment issues. But if that little bit made a difference, I would say that there's very realistic hope for recovery.
Yeah.
And I
So
don't
how are you
care-
feeling?
I don't care what it looks like. I don't care what it
Big
looks like
difference.
on the film.
Thank
You
you.
did it.
That's
Thanks.
awesome. Well, let's sit back over here and just
Wrap up a little.
wrap up a
Okay,
little. That
sure.
was amazing.
Yeah.
Okay. All right. I'll let
Fun,
you come this
too.
way. Okay.
Hello
that-
again.
Oh, someone was asking about teeth. How does that work? Are you
Well,
able to make it? I mean, it's all bones, right?
all right. So I'm not a dentist, and I do go to one, and I recommend that people find a good one, and especially one who's more holistically oriented and would like to see the mouth in the context of the whole body. If the temporal bones are out of alignment, then the mandible, which is the lower jawbone, doesn't have as good a place to sit. Now, once you have that corrected, there could also be some work that might need to be done with the teeth.
Like orthodontia or something.
For example, that would be one approach. Again, I'm very clearly not trained in dentistry, but I have seen teeth move. I've seen jaws and temporomandibular joints change a lot. And I think a good partnership and a good relationship between people who would work with the cranium and work with the mouth will probably get better results than either alone.
Right, I imagine that would totally help TMJ.
It helps a lot. And there are ways to get the TMJ muscular pain to go away completely, just as we did with shoulders before.
That's fantastic. Okay, so now, if someone comes to see you, how does that process typically work? How do you tell us how you work?
Okay. Basically, the way I work is I go by appointments. I tend to be booked out a bit in advance. And I don't see people as frequently as some of my colleagues because of the fact that I just don't have room in my schedule. And I try to work more efficiently, taking that into account so that somebody is comfortable between visits. And sometimes I can give them homework, like some points to rub in between. I also work with nutrition and homeopathy and have some other specialty areas within what I do to help with elimination of interfering factors.
So you have a
Uh,
holistic approach.
I believe I have a holistic approach.
So it's typically not a one and done thing.
I would say it's almost never a one and done thing, but I would also say that a very high percentage of patients feel significant improvement after one visit.
Mhm.
Then we build on that. But it's but I love to see people leave my office after the first visit feeling like they've had a positive, life-changing experience. And
Absolutely,
I always go for that.
right.
So, in some offices, a person would go and have a big examination and then a long report of findings, and then finally come in for some treatment, which could be repetitive. And I like to think the work I do is more progressive than repetitive, in that we take on a project and try to get to a certain reasonable stopping point, which has a lot to do with how much the body can handle at one time,
Right.
and then take the next step after checking to make sure we didn't just lose everything from the first visit.
Got it. Now you teach this training process.
I teach this alignment process to people with doctorates in appropriate healing arts.
Okay.
And I have taught classes for lay people before in methods that are safe for them to use, which can include things like the injury recall technique version that I'm using now, which I didn't know it the last time I taught it. I taught a class called Kinesiology is for Everyone. And I think that we can do a lot for ourselves without having to go to a practitioner, and that there are reasonable and safe limits to how far to go with that.
Do you have any classes that are coming up?
I don't yet, but if somebody wants to get in touch with my office through my email or through the website, I have a website which is called Head to Foot, HEAD, the numeral 2, not the word TO, foot.com. And I have a contact form there where you could just write to me at Dr. Stuart, DrStuart, at head2foot.com. And if you're interested in classes, that might get one to form soon. And for the people who are here live, I also do have some business cards so that you can reach me that way.
Fantastic. And on our replay, Will, and on this email that went out, your contact information and your website are there as well.
Oh, thank you. And then also, let's see, so don't forget, because you know how to reach me. I'm in Houston, Texas. That's important. And I'm trying to not just be in Houston, Texas through teaching other practitioners, because, well, yesterday was a day off. I saw somebody who came in from offshore, somebody from India, a doctor from North Dakota, and several other people on the day that I'm not supposed to see people, and a few emergencies. But I tend to be booked in advance.
Yeah.
But we try to take good care of you and get you in as fast as we can. And
So if someone isn't able to come and travel to Houston to see you, the doctors that you've trained in your A.S.A.P. method,
yes,
how are they able to find those doctors?
best way right now would be through my office. I've only taught the class one time, and we had a couple people from Maryland and one from California and one from near Fort Worth, and some more local people.
Mhm.
But
But if there was enough interest, you would certainly teach it again.
I intend to
Mhm.
in the new year. I would love to teach lots of classes in that and grow this, because I have seen in my own work and in the feedback from the doctors I've taught the value of it. Now, if you go to my current website, you will see nothing about A.S.A.P. on it. Just haven't gotten around to having something written about that that's on the web, but that's
All right, you
coming.
web designers, you got to reach out to Dr.
Well,
Stewart.
we've got that covered. We just have to get that work
Take the
done.
time to
And
do it. Yeah.
I have a feeling it won't take too long to get something up, but that depends on people's schedules besides mine.
Well, I love that you.
Yeah, and I was busy getting operated on and other things, so it slowed me down.
Yeah. Well, I love that you took your traditional chiropractic and your other healing modalities and that intense study that you've done and the documentation of what you've found over the years,
Thank you,
and
Mary.
you've put it into a teachable, very effective, as we've all seen, format. So
It's
that's
really
awesome.
something I'm grateful to have been able to bring here and to share while I've got the chance. And
We very much appreciate it. And we have people saying thank you in the chat, and thank you for teaching others. The world needs you and your techniques. So
thank you.
So yeah. Well, thank you all for tuning in, and we thank Dr. Stewart for being here, and we'll send out the recording to you soon.
Okay.
So, all right.
Thanks so much for joining us.
All right. Bye, everybody.
Bye-bye.
The numbers, presumably.